In this tutorial, we will learn how to take customer impressions with proper technique. On a clean, flat surface, tape down the work mat. An unsecured work mat will make it difficult to use impression material later on. Open the impression containers and pre-mix unactivated material. Settling can occur during shipping and may affect the curing process. Apply a thin layer of Vaseline to the customer. This is important as the Vaseline acts as a mold release after the impression material has cured. Do not leave clumps of Vaseline or a thick layer, as this will destroy details in the mold. Paper towels may be used to remove excess Vaseline. Patients may shave excess hair if desired. Tape the guide wristband approximately 2 inches proximal to the customer's styloid. This serves as a marker for how much coverage needs to be achieved with the impression material. Position the customer in a desirable pose. This needs to be relaxed and unstrained. Position the thumb in opposition with a slight curve to all of the fingers. Do not allow the patient to splay the fingers or hold other uncomfortable positions. Add 1 bottle of catalyst to 1 container of impression material and stir thoroughly. An uneven mix can result in uncured material. The work time is approximately 3 to 5 minutes. In warmer temperatures, this time will be reduced. Impression material must be refrigerated to increase work time. Apply the activated impression material generously to the customer's hand. This should be done quickly and thoroughly. Again, do not allow the patient to splay the fingers or hold other improper positions. Make sure impression material covers the entire hand in between the fingers and fingertips. Try not to allow any holes or thin spots to appear. Excess material can be scooped off of the work mat and applied to the hand to fill in any holes or gaps that may appear. This is why it was helpful to tape down the work mat before we began. A second container of impression material may be catalyzed and used to cover the hand up to the wristband, approximately 2 inches above the styloid. Enough length of the wrist is crucial in creating a proper prosthetic, and impressions which are too short may need to be remade. Note the poor pose, holes, and thin spots and poor wrist coverage in the bad impression on the left versus the good wrist coverage and thick nature of the impression on the right. With the customer in a relaxed standing position, wait approximately 3 to 5 minutes for the impression to cure completely. Pressure may be applied to the wrist to relax the patient's hand and fingers. When excess material on the work mat is cured, the impression is ready to be removed from the customer. If the material is tacky to the touch, wait a few more minutes. Never use sharp objects or scissors to remove the impression. Create a small tear in the impression at the top of the wrist. Minimal tearing of the impression is acceptable, but try to reduce the amount of damage necessary to remove the impression. Instruct the customer to wriggle his or her fingers to break the seal of the mold. Remove the impression at a slow pace to avoid ripping out surface hairs around the wrist. When the customer feels ready and that the impression has loosened around the fingers and thumb, firmly grab the impression and slowly pull it off. The customer may pull his or her arm in the opposite direction to fully loosen the mold. Following these steps should result in a full impression with proper pose and appropriate wrist coverage with no holes or thin spots. Please pack the impressions with paper towels. This will ensure that the impressions hold their shape and form during the shipping process. Heat and shipping time can cause impressions, especially larger ones, to sag and lose their shape. Place the impressions in the enclosed shipping bag. Now place the bag with impressions and the container opener in the shipping box and return to livingskin. Thanks for watching this video. Here are some helpful reminders. Do not apply excess Vaseline. Excess Vaseline will remove details in the impression. Use the wristband to achieve proper wrist coverage. Pose the customer's hand in a relaxed position with the thumb in opposition to the fingers. Do not splay the fingers or strain the hand. Apply the impression material evenly to avoid holes or thin spots. Apply impression material up to the wristband 2 inches proximal to the styloid. Thank you for watching this video. We look forward to receiving your customers' impressions and working with you. If you have any questions, please contact touchbionics.